So, Victoria, amazing to have you on our podcast. I'm so excited. You may not know, although I think I told you, you and Andy have been a deep inspiration to me over decades of my career and was partly why I set up the National Centre for Integrative Medicine in that name. So it's super exciting to be talking to you. I just thought we'd start with that question. Why does integrative medicine matter to you?
Thank you so much for having me on your show. And thank you for that lovely compliment. Really, that has been one of the most meaningful things in my career is the opportunity to share what we're learning here in integrative medicine with our fellows and with people from around the world. And I well remember you coming and visiting the University of Arizona and sitting in on some of our fellowship meetings and hearing a little bit about your goals. So it's very exciting for me to see and to learn about, and a couple of years ago to be in London and just witness all that you've accomplished. So thank you. Integrative medicine matters to me because fundamentally it's the way that I believe medicine ought to be practiced worldwide. It is a form of medicine in which we connect deeply with people. We care about them as whole people. So not just my back hurts or I have a headache or I have diabetes or whatever the presenting complaint may be, but what is it that makes somebody tick? Really what matters to them. And we seek to understand broadly who this human being sitting across from us is, from the body, from the mind, from the spirit perspective.
Yes, and I loved, and we will be diving into your new book, but I loved how bold you were at the beginning. You know, saying for all of those of you who want to stay well, those of you who want to avoid medication. I loved that call to action. Just talk to us a little bit more about that because it kind of reflected, I think, a very confident view of the way you'd like medicine to be.
Yes. Well, Heal Faster fundamentally points to our innate healing system, the brilliant internal systems we have that allow us to get well. And for those who are listening are going, well, what? What are you talking about? I mean, think about it. If you cut your finger, you can clearly witness this in action. The cut gets a little red, it gets a little swollen, it may be a little sore, but assuming that it's clean, it heals over the next few days. That happens when we catch a cold. That happens if we injure ourselves. If we injure ourselves badly, for example, we break a bone, well, then we have to align it. But once again, the bone heals. It happens when we're emotionally upset. We find ways to soothe. So it is a natural and innate part of us that healing happens. There are sometimes impediments, and we can talk about those, but I believe that somehow we've gotten caught up in this idea that medicine will cure everything, that there'll be a pill that'll fix whatever's wrong with us or a surgical procedure. And this is not to discount the incredible advances in medicine, in pharmaceuticals. We really are living at a time where things that were once deadly are no longer so. But those things fundamentally work with our healing system. And we have learned, despite those advances, we have more chronic disease than ever. So we need to bring back the primacy of what our healing system can do to restore homeostasis, to restore well-being.
I think this is so crucial. It's like we've forgotten how to trust the body. We've
Mm.
forgotten about how we're connected to nature, and there are things there available to us. And as a palliative care physician, I just remember morphine, thinking, wow, there's a poppy plant and we've got receptors to those opiates. And it told me about that innate connection. But I just love that you've been bold enough to say, guys, with the right support, with the right engagement, we can help that healing process more frequently.
And I love that word trust, because I think fundamentally this is a kind of trusting in the body, but also the two of us as physicians, trusting that our patients can find the wherewithal to get better. And we serve as partners. When I meet with a patient, I often um, hear, of course, about the illness that's brought them in. But before I give my recommendations, I like to summarize all the things they're doing well. So I might say something like, you're here for, and fill in the blank, and you take walks every day. You have a loving relationship with your spouse. You eat a healthy diet. I point to the things they're already doing well, and it's very intentional. It's to acknowledge all of the ways in which they have the skills, they're doing things that will contribute to healing. And then I'll say, and there are some additional things that I would recommend that will help you in this process. But it's framing my trust, my faith in their ability to overcome whatever it is that they've come in. And I don't want to be Pollyanna about this. If somebody has stage 4 cancer, which you as a palliative care physician see, I'm not going to say, trust in your body, it's all going to get better. But so much of what we see can get better.
Absolutely. And I'm modular lead on our master's program for holistic consulting. And that holistic synthesis that you just described, real time with the person in front of you, is a real skill to develop. But what it allows, as you've said, is to kind of align someone with what they're doing already and then just go forward together a few more steps. So it's just beautiful to hear what you do. And I
Thank
do
you.
it with my letter as well. I reinforce that and try and give very few recommendations actually, because people get overwhelmed otherwise, don't they, with things to do. Yeah. So I do want to ask you about how did you get into integrative medicine? What was the turning point? What was the shift for you?
In some way, I think I've just been wired this way. I went to college, to university, and I was very interested in this question, which has been a core question. How do you help people lead healthier lives? And so in some ways, it might have made sense for me to go into public health. But at that time in the United States, public health was very focused on infectious diseases and hygiene. And it wasn't really focused, as it is much more today, on this question of how do you help our society be healthier so that they're less likely to get sick. And so that central question then did lead me to medical school, and I trained in family and community medicine at first, which of course is a larger, more of a generalist, I think your GP role. And I very much focused with my patients on that question of being healthy. Over time, as the treadmill of medicine, I like to call it, got faster and faster, I didn't feel good about the ways in which we were practicing medicine. I felt like we were putting Band-Aids on problems instead of understanding a little bit more of what the root cause was. And just around that time when I would say became rather disillusioned, Andrew Weil at the University of Arizona had begun a fellowship. Now, I had been in practice for 9 years, and there was a part of me that really didn't want to go back to training. I had 3 young children. I was established in Northern California, but I heard what he was doing, and I felt a strong kinship to the mission of it was then a small program in integrative medicine. And so I moved my whole family and we resettled in Arizona. I was a fellow for 2 years. And then as I was finishing my fellowship, there was upheaval, let's say, and the program almost was closed. And Dr. Weil asked if I would step in as first the interim and then ultimately the executive director, the role that I've had for 23 years.
Wow, 23 years. And in that time, what do you feel you have seen in terms of changes in America and maybe the world, but maybe in America with this fellowship?
Sure. Well, I know what's happened in the United States better, of course, than across the world, although I do think this is a worldwide movement. In the United States, when we first began, there was, I would say, a lot of skepticism, and our fellows had to combat that skepticism. Often they were the only person who shared this set of values and principles, and that could be rather challenging. We began with a residential fellowship. That is the fellowship that I experienced. It was 2 years in person in Tucson, where we saw patients, we had patient conference, we learned together with a team of really wonderful providers, psychologists and naturopathic doctors and Chinese medicine providers and herbalists and a shaman. I mean, just a really wide and diverse team of people who helped us learn how to manage in an integrative way the challenges that patients were coming in with. And when I became the director, we very quickly grew the program to create the fellowship that you visited, which is a hybrid. It's 2 years in length, but people don't have to move to Tucson. They mostly do it online, and they come to Tucson for 3 residential weeks, one at the beginning, one at the middle, and one at the end. And we have a clinical mentorship where they meet in small teams with people who share their background, their specialty training, and work with that mentor on particular clinical issues that they're seeing in their practice. So they do it while they're still in practice. We ask them to commit 8 to 10 hours a week to their training. And this has become very successful. We started with a class of 40 once a year. We now have a class of 80 that we do twice a year. So it's grown tremendously. We've trained physicians from every state in the United States. We've trained about 2,500 physicians through this fellowship program. But we've also had physicians from all over the world, from every part of the world, come and do this training program. And then some of them have led programs in their country. Our graduates are leading programs in Brazil and in Ireland, in Israel, in many countries around the world.
Yes, it really does feel now that we are getting traction and connection and the world of functional medicine brought us this phrase root causes, but you and I
Yes.
would have been using this idea of root cause. I think the other thing that's been really important that your book, which we'll move into a bit, brings up is just this idea of symptoms as information. I feel like that's another crucial part of holistic practice is actually listening to the body and allowing the person to connect to the body. And so seeing a book full of approaches for a range of conditions, just tell us about the book. What inspired you to try and put all of these things together?
Well, as we know, in our clinical practice, we could see a set number of people. And training physicians, which is incredibly rewarding, we both do that. Also, it amplifies how many people you can reach. And yet still, there are plenty of people who want an integrative approach, and they either can't afford to go to one because that person only has a private pay situation. They don't accept the health insurance, or they're too busy. They're just full, or they're too far a drive. And I really wanted to put all that I've learned over almost 40 years of being a physician into an easy to read resource where people could, on their own, begin to understand that their symptoms, as you say, may be showing them the direction they need to take in order to be healthy and whole. And that is very different. In our typical conventional or Western medicine, we use what we call suppressive treatments. So if
Yes.
someone has a headache, we do what we can to suppress the pain. In integrative medicine, we might use a treatment like that, but our goal is really to say, well, what's causing the headache? For example, people with migraines might have some micronutrient deficiencies. And so if we give them things like magnesium or riboflavin, they may not end up with migraine headaches, but maybe they're triggered by fragrances. We have a lot of artificial chemicals in fragrance in the United States, and maybe that is their trigger, or cigarette smoke. So beginning to understand, well, what triggers those migraines? Stress, of course, is a common trigger of many conditions. How can you better manage that stress so that when the headache occurs, instead of being, okay, now I have to reach for my pill, it becomes, oh, now I've got to make sure I'm doubling down on my exercise, on eating healthily, on getting a good night's sleep, on, oh, I haven't taken my magnesium in 2 weeks, whatever it might be. I need to resume those behaviors so that the headaches disappear. And that's just one simple example.
Yes, and I can see that people have been de-skilled. In the UK, people have almost been encouraged to go to A&E, and then A&E say, we can't cope with all of these people. And so this idea of folk medicine, or the wisdom of the home, like having things in your home, I think is really, really important. I also noticed that you do quite a lot of exclusion diets. I just wanted to find out more about that where that's come from, and how you put that into practice in simple ways.
Yes, I will, but I wanna say something about, this idea of folk medicine.
Mm,
Absolutely, there's been this loss of, skillfulness that
yes.
perhaps the wise herbalist in the town had, or it was just passed down from mother usually to daughter, and was in the home, and knowledge in the home. And that's part of what I think we set aside when we embrace that modern medicine would fix everything. And so we started to look down on some of those simple things. But I also want to say that one reason I think integrative medicine is embraced more than when we started this 20, 30 years ago is that the evidence for it continues to
Yes.
grow. And
Yeah.
so, for example, now we have all of these studies about the benefits of magnesium, and it's
Yes.
not just a home remedy. It's also something that is well regarded. For example, in the United States, our neurological societies speak about magnesium for prevention of migraine. So it's not just a home remedy anymore. It's moved into mainstream for people who are paying attention who are studying. And the book has a toolkit. I totally agree. I think it's good for us to have some of these tools in our pantry so that if we have one of these symptoms, we can address them more quickly, perhaps, and not be, well, what do I do? And yeah.
Yes, and having them there, just with magnesium, again, I feel the States are further ahead than us. We've got a few neurologists recommending magnesium for migraine, but there's still pushback, around, oh, you just pee magnesium out, you don't
Yeah,
need it.
right.
Whereas it is one of the common things with, women's health, perimenopause, migraine, and as you say, the evidence is assisting us on this wave
Right.
of change to be able to
Yes.
stand up proud and say, this is really worth doing. In fact, just a young friend come off SSRIs, feeling low, not wanting to go back on them because she had a hard time coming off them. And I recommended saffron just to help build her 5-HT, and there's good
Mhm.
evidence emerging for saffron. And she's feeling a lot better. And I think also just so glad something's helped that didn't mean she had to return to a antidepressant. So the evidence is
Yes.
important, but also these things are important, aren't they,
Yes.
in our
And
toolbox?
yes, and, one of the things I write about in Heal Faster that I love about these natural products is they often have what I call side benefits. We're used to hearing
Yes.
about side effects and adverse effects,
Yes.
but As, going back to the magnesium, a lot of people wrestle with constipation. Magnesium helps with that. As we talked about, it helps prevent migraines. It's one of these things we call a neuromuscular relaxant, so it often helps people sleep better. And it doesn't necessarily have to be taken orally. You could put a cup of Epsom salts, which is magnesium sulfate, in your bath before you go to bed. And so these are gentle treatments from nature that often do have side benefits. And we know, for example, the antidepressant, which people sometimes need. This is not to say no one should ever take an antidepressant, but they tend to have side effects. And for the SSRIs, people do have a terrible time going off of them. Not everyone, but a subset of people. And they can be associated with some really unpleasant side effects. For example, weight gain is common. Having difficulty with achieving an orgasm is common. And so it is a wonderful thing to have these more natural, less likely to cause side effects, perhaps leading to side benefits in our toolboxes as physicians to help people move towards that sense of well-being.
And I think that was my key, drive, was to reduce side effects, of having to prescribe multiple medications
Mhm.
in the cancer field.
Yes.
Here we've got a whole range of approaches, and just today we did a bit more training around medicinal mushroom in cancer treatments, and they've just completed a lovely placebo-controlled trial in colorectal cancer showing this mycodigest. This is Hephaestus, but which would just be one of many medicinal mushroom suppliers. But what was beautiful is seeing in the treatment arm rather than placebo arm a rise in the natural killer cells. So what we've got there, along with fasting, suddenly we've got these many approaches that could come together to allow people to build resilience during difficult diagnoses.
Yes. And I think oncology is one of the areas where people are most eager because the conventional treatments, which have become more and more effective, are also, I'll use a strong word, harsh.
Yes.
They're not easy for people to sustain. And so, using a medicinal mushroom, which helps support the immune system and makes it less likely that you're going to get, for example, a respiratory infection while you're going through
Yes.
your treatment, which then is going to force you to defer your treatment. Fasting, which you mentioned, which allows people to tolerate their chemotherapy better. Again, that's supportive because then they're more likely to complete the chemotherapy, which is very effective for an effective course of treatment. So these are sometimes in place of, we talked earlier about migraines. We might use these natural treatments in place of pharmaceuticals to prevent migraines. But sometimes, as in cancer treatment, they're adjunctive, where we add them because we know people will be able to tolerate the conventional treatments more easily, complete the treatment course, and restore their overall sense of well-being, health, and wholeness more rapidly.
Yes, and I loved your chapter on esophageal reflux, such a common condition. Almost everyone is on omeprazole. For my own personal journey of having escalating doses, this is about 20 years ago now, I thought this just isn't, sustainable, 20,
Right,
40, 60, 80.
right,
And it just reminds me, occasionally I will use omeprazole if I've run into a difficult patch, but I have all these other things.
right.
And I wondered if we could go into that a little bit because I noticed D-limonene. Now, one of my journeys was yogi teas, which are
Ah,
amazing,
yes,
stomach ease, plus
yes.
lemon juice was one of my journeys out of omeprazole. But you've included D-limonene. Would you say a little bit about that as a
Sure.
combination?
Yes. So, just to back up a second, lots of people have what we used to call heartburn. Now we call it gastroesophageal reflux disorder. It's become a disorder. It
Yes.
used to be, okay, we ate something that didn't agree with us or that we
Yes.
knew we shouldn't. And earlier you asked about, and we didn't go into the exclusion diet or elimination diet. And this is one of the places where that matters, because if
Absolutely.
you know that wine, as an example, that's what does it to me. If wine causes you to have some of this heartburn or GERD, then maybe you should not drink the wine rather than take the medicine. Or maybe it's, your, best friend's child's wedding, and you decide you're going to have champagne and celebrate, and you'll take an omeprazole because it's a very rare feast kind of celebration, and you're going to embrace that and pay for it perhaps, but you'll have a tool to help you manage. So this
Yes.
is not about never enjoying the things that you might want to enjoy. Sorry, you were going to
Yeah,
say
I was just
something.
going to say that for me, it's chili and garlic. And I've now started to say to people when they say, is there anything you can't eat? My God, the
Yeah,
chaos I cause by saying
right.
I can't eat chili or garlic. Because everybody
Yes,
puts it in everything. And my
yes.
my daughter's set up a wonderful organization called My Grateful to support refugee and asylum seekers. And one of the Syrian chefs, who was also a refugee, her recipe for falafel included 15 cloves of garlic. And she just thought I was an anathema, someone who
Yes,
couldn't eat garlic. But what
right.
I've realized is if I exclude it, it makes a huge, huge difference.
Right. And so this is where we learn ourselves over time. We learn our triggers. And garlic is a pretty common trigger for people. It's part of that group that we call FODMAPs, which can cause both heartburn but also irritable bowel syndrome. And garlic, onions, they're delicious in food unless they're not delicious for you. Wine, as I mentioned, for some people, chocolate, for some people, spicy foods. That could include tomato-based foods. There's a lot of different triggers, and you figure out what they are for you, and you let them go. For me, I can't have gazpacho. I think gazpacho is delicious, but I pay for it, and so I don't eat it because
Yes.
I'd rather not pay for it. But if you do have an occasional indiscretion where you eat something that you're going to pay for, there are things that you could do. I usually do start with things like licorice, the deglycyrrhizated licorice, which is in DGL, coats and soothes, and it's a really lovely thing to use. Not everybody likes that taste, but if you like the taste of black licorice, you're going to be just fine. An antacid like Tums could also, that's calcium carbonate. It can coat and soothe, and that's fine. Using a PPI once in a blue moon is fine, but using it all the time has some significant side effects. It prevents the absorption of calcium, which means as women, we're at an increased risk for osteoporosis, which is so common and so problematic later in life. We know that there's a reduction in stomach acid. That's how they work. They stop you from making stomach acid. Well, stomach acid actually is part of our defense mechanism. It's part of our rapid recovery mechanisms, and it will kill bacteria because that stomach acid is so potent. So there's more C. difficile if you don't have stomach acid. There's more pneumonia. I mean, there are problems with long-term use. And so when people are on PPIs and they say, but when I try to go off, I have this rebound where I'm just miserable, and that can happen, you need to taper off slowly.
Yeah.
You cut the dose in half. Maybe you go every other day. I talk about how to do this in Heal Faster, but you add in things to manage the symptoms. And one of them is D-limonene, which is a dietary supplement. It's made from citrus peel, and it has this effect of helping to manage the stomach acid. Another is either the Yogi tea. You mentioned stomach ease, or I like the Egyptian licorice, which has a higher dose of licorice to soothe that lining. There are other things that you could do, like slippery elm, which again soothes the lining of the stomach and are very helpful as you're gradually going off of the prescribed or over-the-counter class of PPI medicine, and they allow you to get off them without that terrible rebound of acid production.
Yes, which is so disconcerting, and common if it's not managed. We're lucky in Bristol, we have a beautiful botanic garden, so I tend to take the medical students there when they do student choice placements, and they often say, "Why don't we learn about this at med school?" What and I wanted to ask you, because you've got so many years of experience, why do you think we have shifted to a position where it's all around PPIs, even though we know that they have significant side effects? What do you think is the energetic forces that are coming to play with that?
Yeah. Well, I think it's multifactorial. As you said, we no longer teach the science of plants in medical school. That used to be part of the curriculum, but you have to go back at least 50, 60, 70 years. It's been a long time. So you have most people in practice never learned plants. The second thing is that we've been talking about how wonderful these plants are and the connection to nature and how fascinating it is that there are receptors in your body that match us with plants like the poppy plant. Um, at the same time, in general, these are much weaker, and that means that they're going to act more slowly. And we live in a society that likes things fast. So the omeprazole works very rapidly, and people are grateful for that rapid relief. And as I
Yes.
said, if it's a very occasional use, that's probably fine. But I see people who have been taking these PPIs for 5, 10, 15 years. They're only really meant to be taken for 8 weeks, unless you have something like Barrett's esophagus or some other cause where you must be on them long term. But for the average person, it's only supposed to be 8 weeks, and yet people get on them, and then they find if they attempt to stop, they have this rebound of acid production. So I think that we've put our faith, we talked earlier about putting our faith or our trust in these potent medicines. And while they are certainly effective, they have downsides that often the plants, which work more slowly, do not have.
Yes, I think that's crucial. And you also bring into focus this idea of not the quick fix, not this isn't going to happen fast. And I don't know whether we could talk about your sleep chapter, which I loved. I loved the way that you would bring two prayers in to that
Yeah,
chapter. In other words,
thank you.
really a deep dive as well as a broad view.
Yeah. Well, it's really important to me that people appreciate that integrative medicine, which we talk about body, mind, and spirit, we then must live that. We must talk about, well, how do we talk about the spirit, for example? And the United States, many people have religious practices, and I think we, as physicians, can ask people, is there a religious faith practice that's important to you and that may be helpful? So part of many people's religions is to say a prayer before they go to bed. And that often soothes people's spirits so that instead of being anxious or agitated as they're lying down and they have their worries, they're reasserting their faith in God, and that then allows them to enter into a quieter, more relaxed state that's more conducive to falling asleep. There are secular practices. I speak about that also. Yoga Nidra, for example, is a secular practice that again combines guided imagery, sometimes with some music, and it quiets the spirit and allows a person to be in a much more receptive place for sleep. And so throughout the book, where it's appropriate, I do speak about what I've learned over the years, often from my patients, sometimes from other physicians, sometimes from religious leaders, about ways in which we can incorporate not just the physical things like plants, but also the mind-body approaches and the spiritual approaches that people have. And sometimes we just have to remind people, like, I'm not teaching people prayers. I'm asking, is there a prayer in your tradition that you could use at this particular moment?
And you're validating it. At that point, you're saying this matters.
Mhm.
And sometimes people care that it matters to you. Um,
Yes.
because, we sleep particularly can lead to despair, can't it? People can feel like, I just can't get on top of this. So I think it's beautiful, that idea of the mind, body, spirit. I also loved that with that chapter you start with case history, but then move into knowledge.
Mhm.
Knowledge is also power. So
Yes.
explaining to someone the different stages of sleep.
Mhm. Yes.
I really liked that before trying to talk to people about what we might do.
Mhm. Yes. And I find this fascinating. I mean, I have loved over the course of teaching integrative medicine, learning the science.
Mm.
And the science of sleep is fascinating. The ways in which our body, our mind move through these different phases. Sometimes we're dreaming, sometimes we're in very deep sleep, sometimes we're in a more superficial kind of sleep. And then I actually have, I don't know if you could see it, but I
Ah, yeah.
actually wear a device. For me, it's an Aura ring, but there are these different devices that give you information. And I think that the advantage of these wearables is personalized information, which perfectly aligns with integrative medicine. So, is your difficulty that you are having trouble falling asleep? You lay down and it's an hour before you fall asleep. Is your difficulty, oh, I have people who say, no, I have no trouble falling asleep. It's that I wake up at 2 a.m. and I can't go back to sleep. Well, the sleep tracker may show you were only awake for 10 minutes. That's fine. It's normal to wake up and be awake for a little while in the night. If you're awake for 2 hours, that's not so fine. People, when you say, "How long do you go to sleep?" And they say, "Well, I go to bed at 10 and I wake up at 8." So it sounds like they're getting a lot of sleep. But when you have them track their sleep, you find out that they're frequently awake, that it takes them a long time to fall asleep, that they're awake in the night, and actually they're not getting sufficient sleep. So it gives useful information that then helps tailor their approach. Maybe they need to cut back on their coffee so they're not having the effect of caffeine interfering with sleep. Maybe a quieting practice like breath work or guided imagery or prayer is going to help settle them so that they sleep better. There are some supplements that we sometimes use in this situation. All of these things then are based on both the science, understanding the mechanisms of sleep, and the personal information about what does your patient's night sleep look like and how can you help them get a better night's sleep.
Yes, I love that. And also, more recently, understanding better myself about the circadian rhythm. Rather than necessarily prescribing melatonin, which is now available to us, just realizing, getting out into that early morning sun and strengthening circadian rhythms. And what I love about integrative medicine is I'm often doing the things. So you're like wearing a ring, but I've been getting into morning sun, and
Yes.
I've been finding that I'm waking up earlier at the same time. So I've got kind of direct evidence that what I'm doing is shifting. And I think that's the other thing I love about the science and the knowledge, is sometimes that means you might not need to take a medication.
Mhm. Absolutely. And I love that you shared that you do these things on yourself. You experiment with them on yourself.
Yes.
I do that whenever possible. I haven't taken medications I wouldn't want to be on for the sake of knowing how they feel to my patients, but I have had acupuncture, I have had an Ayurvedic evaluation, and I absolutely have done the circadian rhythm things you just mentioned, which first, when you wake up, that morning light, and even if it's cloudy, it's so much more UV exposure, so many more lux of light than you would ever have with an indoor light, unless you're using one of those special light boxes, which we sometimes use for depressed mood. But going outside resets your clock and is a very powerful form of medication. We're just learning. This is very new science, the importance of the circadian rhythm and the things we could do to support it and the things we do that interfere with it.
Yes, absolutely. I can't believe that we're coming up to the end of our time together. And
We
I
could
just
talk
want,
for hours, couldn't
I
we?
know we could. But I just wondered if there was anything else you'd like to share with the listener and viewer. This is your first book. You've written other books, and we'll put into the show notes all the links. But yeah, I just wondered, is there anything else you'd like to share with us?
Well, I want to say that it's very exciting to me that we are in conversation. We live across the pond from each other,
Yeah, yeah.
and this is happening across the world. And one of the things that I love about the UK that I think is much ahead of the United States is your social prescribing movement and the ways in which again, that whole person. Where do you live? Do you have access to healthy food? Can you get outdoors to exercise? What do you need? What support do you need to live this healthier life? And so, my hat's off to all that your government and your medical systems are doing to support people's health through social prescribing.
Yes, and we are excited at the moment because the NHS 10-year plan that was published, they could see that a healthy GP practice not far from us in Frome was making incredible differences in medication hospitalization. And what that practice was doing was really majoring on social prescribing, but there was something else as well, which was developing neighborhood. So now in the 10-year plan, there's a whole movement to create neighborhood. Something again we've lost, we've lost the wise woman, the herbalist, but also that sense of our connection in a supportive community. So I am really proud of social prescribing in the UK and also the research again that's really developing all the time to show that resourcing individuals and communities really make a difference. Yeah,
Mhm. That's
yeah.
awesome. And it
I,
speaks to this refinement. We learn something and then we test it and we learn a
yes.
little bit more. And that's how science progresses. And it's really wonderful that your government is looking at how do we do this yet better and that additional importance of cultivate neighborhood. Not just the individual with the individual needs, but the larger context of the neighborhood.
Yes. And just also they mention now prevention and lifestyle, but there's a little bit of a gap between how to do prevention. And I think that's what integrative medicine is so good at, because at the heart of integrative medicine is the idea of let's pick things up in the early imbalance. And I think that's what I love about your book as well, is that let's try and get to this sooner rather than later so that you can stay in balance and stay connected to your healing force within us.
Yes, and how much each individual how much power, how much authority people have over their own healing system when they
Yes.
have good information to work with.
Yes, I so believe that. Putting people back in charge and then you watch them.
Mhm.
Just a quick thing from my clinic on Monday, someone living in the north of England, she actually did a number of things, but she also decided to go and buy Monjaro. I know this is quite controversial, weight loss drugs, but she knew that with her cancer, if she could lose weight, she would reduce her risk recurrence. And I just was thought, wow, like you need to go with what people are finding useful for them. And that's what I love about the integrative medicine model, is that it's actually got everything in it.
Mhm.
It's
Yeah,
not an alternative model, it's got everything in it.
yeah. What a
Good. Well,
wonderful conversation.
we have to finish, but thank you so much. Early in the morning for you, late afternoon as it goes dark here. But thank you so much, Victoria, for your time and for everything you've done for this movement for change.
Thank you, Elizabeth. Igualmente.